Hello, this is Olivia Kleiner. I just wanted to take a few minutes of your time to share about this project that I am proposing for my class, for my internship. We have to come up with a project called the Change Project. And this is called the Change Project because you're supposed to think of something that would leave some sort of lasting impact on the agency. And through my experiences with Caitlin and Melissa, I've learned that documentation is somewhat of the Achilles heel in the mental health world, and that oftentimes it can take a lot of time to complete all the different documentation that is necessary. Because as I've learned throughout my college career, if it isn't written down, it didn't happen. But as I was listening to a podcast the other day, the concept of collaborative documentation came up, and I was interested in it and did some extensive research in the literature available to us through our databases. And I just want to take a few minutes of your time to outline some of the benefits and challenges to this type of documentation, as well as present an implementation plan how this could be used in Peace Purpose Center Resiliency Team. So what is collaborative documentation? So collaborative documentation is a model for concurrently documenting content and process whereby providers and clients collaborate in creating intake and assessment summaries, treatment or service plans, and progress notes. So the core principle of this is the ongoing dynamic clinician-client interaction that results in the jointly composed mental health record. So this happens in the session where clients and clinicians work together to create their treatment plans, and the client actually is able to provide direct input in their plan and see the plan. So you may be wondering, do clients like this? Like, is this helpful? A survey of more than 15,000 mental health clients with CD or collaborative documentation experiences. Of those, 82% reported that the practice was helpful or very helpful. So this shows that not only are they just okay with using CD, they actually found that it was a helpful process. And of those, 70% reported that they would feel favorably of using it in the future. So some benefits for the client of using CD include engagement and adherence. One study showed that there was a statistically significant increase in medication adherence and a decrease in appointment no-shows. So because clients had more ownership, because they could see their progress notes and be a part of that process, they were more likely to adhere to their medication and show up for appointments, which is, as we know, very important. Another benefit is a increase in the therapeutic alliance. Another study found that there was a statistically significant positive relationship between CD usage and greater scores on therapeutic alliance. So this means clients actually felt like the relationship between client and clinician increased because of this process. Some more client benefits include empowerment. This process creates empowering messages such as, I'm capable of planning and describing my own treatment. My words are important enough to use in written documentation. I have the right and responsibility to review records and even correct my therapist if needed. And I'm cognitively and emotionally able to manage this information, which are super empowering messages that increase the therapeutic process. And also a client benefit is transparency and trust. Sometimes mental health providers create this phenomenon that they have this mystical information that a client could never understand. And this process kind of demystifies their mental health treatment and allows the client to have an improved sense of efficacy in their treatment and an increased trust in the clinician. Some benefits for the agency include accuracy of documentation. Because clinicians are finishing their documentation primarily right in the session. This leads to much less susceptibility to memory difficulties, and clients can correct when needed. If a therapist is writing something that isn't quite accurate or most important to the client can say and give input. Another benefit is the service quality. Because this type of documentation reduces the amount of time spent on documentation, that time can be reallocated to trainings, more direct services, and things that improve quality of service. And then lastly, a benefit includes respect. Because the client is with the clinician when they're creating their progress notes and their treatment plans, they're challenged to describe their interactions in a more productive and respectful manner, being that the client is sitting right there when they're going through the notes. Some of the clinician benefits include efficiency. On average, this type of documentation reduces 8 hours of paperwork time per clinician. That is 8 hours of work time that could be spent on trainings to improve their skills, more clients, more direct client work, and so many other things. This also could result in an increase of quality work life. Because there's a decrease of stress due to paperwork, this leads to more productive and enjoyable activities for the clinician. And this process makes the clinician feel like their paperwork is a part of the therapeutic process. So it's not seen as something that I just have to get done for my boss, but it's actually a part of therapy, which is more appealing. Some of the challenges to this type of documentation is distraction. So computer usage may inhibit some rapport building and make it difficult for the clinician to attend to the client. They may miss some subtle body language if they're focusing on the computer. Obviously, with telehealth, everything is over the computer, so that's not as much of an issue. However, when you move back to in-person services, that may impact rapport building. Also, another thing that's come up in the literature a lot is clinician resistance. Even though there is a lot of support from clients, clinicians seem to be resistant towards it. They speculate whether it will lead to client distress and disruptions in their relationship, and sometimes feel that it places their burden of paperwork on the client, and don't feel like that's right. Another challenge may be vague documentations. So as clinicians are getting used to this, and if they're not intentional about being direct with their clients and having difficult conversations, they might avoid communicating certain things in the notes that may be upsetting to the client. And this may be helped by some of the notes could be done outside of the session and just the bulk of it happen inside the session. And some clients it won't work for. Just as therapy isn't one size fits all, this isn't one size fits all. So it's not going to work for every client. It's just helpful when you can implement it with clients to reduce some of the administrative work outside of direct services and all those client benefits that we discussed earlier. So the implementation plan of this project, I'm going to be creating an instructional video, an instructional document that will lead employees to the Copenhagen Burnout Inventory. I have a form that they will fill out as a pre-assessment, and this assesses employees' burnout levels. So how they're feeling with regards to their job. And this is directly for clinicians in helping professions. And then I have 2 webinars that will instruct clinicians on collaborative documentation, and that includes the patient-centered documentation and then the collaborative documentation in telehealth environment. And there's an evaluation for both of those. So yes, if you have any questions, feel free to reach out to me, and I look forward to implementing.